Ministry of Health is hosting a one-day mental health and wealth fair here at Main Street. You will hear from some of the key persons, and also hear about some of the services that are being offered here. So I now have with me Mr. Mark Constantine. He is the head of the psychological department. I hope I pronounced that right. Good morning.
Good morning. Good morning. Close enough. I'm head of psychological services at the Ministry of Health Mental Health Unit.
All right. So could you tell our viewers a little bit about some of the services that is being offered?
Okay. Well, the mental health unit saw it fit today being the 31st of October to host this health fair. And this health fair, of course, is to culminate all of the activities in keeping with Mental Health Month. The month of October is so designated, with the 10th of October having been specifically, Mental Health Day. But today we are out here, and the objective of the health fair is mostly public awareness, public sensitization, to let the public know that when it comes to mental health and mental health services, that services are there, they are available, and how you can actually tap into, benefit from those services. We saw it fit to collaborate with several different agencies that are out here today, like adolescent health, we have elderly health, we have several other NGOs apart from governmental agencies. We have NAPSA, National AIDS Program Secretariat. So all of these agencies are out here with us today to sensitize the public about the services that they offer as well. And at the mental health unit, I was just talking to someone and they were saying, there seems to be a lot more awareness, and that is because of the aggressive PR work that, the mental health unit has been putting out, along with the support from other agencies.
Who can seek help when it comes to mental health?
Anyone that thinks that they're facing a mental health challenge. And we know that there is a stigma that has been there for ages on mental health in Guyana. But I also firmly believe that, that is, drastically being reduced, mainly because people are more and more aware of how they feel, and they're also very much aware that they can't deal with certain things by themselves and they need help, more so professional help. So anyone, be it a child, an adolescent, an adult, an elderly, it doesn't matter. Anyone can face a challenge when it comes to mental health, and anyone can also benefit from the services. I would just like to say to the public that if you or anyone you know might be dealing with any sort of mental health related challenge, to reach out and get help. Call the mental health unit on 225-0804 to make an appointment. Better yet, come in and see us at 252 Commoner Street, that is between Camp and Thomas Street, right behind the Ministry of Amerindian Affairs.
Now that you mentioned the telephone numbers and location, persons who are viewing our feature, let's say from out of Region 4, maybe in Essequibo, maybe Bartica, maybe Region 1, they're thinking they can't come to Georgetown to get help. Who can they reach out to, or where can they go in their region?
Well, they can call the same number still, once you have access to a phone, 225-0804, and where it is not practically possible for you to come in personally, we can arrange to do sessions with you remotely, talk to you on the phone even. If you have access to the internet, you can access our website services on www.mentalhealth.gov.gy, and pretty soon the public is also going to be benefiting from a hotline that we plan to bring on stream.
Mr. Mark, I did ask you if you would like to share anything else, but for persons, let's say family or couple who are going through, let's say, a rough patch, so this is a good initiative in terms of they should visit to see counseling as well too, right?
While we do not focus a lot on couples counseling and relationship counseling, our service is primarily mental health, but we know that relationship can also put a tremendous strain on a person's mental health. Yes, persons can come in and we will facilitate them, and if we don't continue with the service in terms of relationship counseling, we will point them into the direction where they need to go.
All right. Lastly, before we go, I don't think the mental health ever had this. You guys are having almost every month an awareness of a health fair through the Ministry of Health. But can us or persons in the future look forward to you guys going home to home and visit? Because there are persons who need help and are afraid to come out because they're afraid that the neighbor might see them or the family might see them and discriminate against them. So can persons look forward for that in the future?
Absolutely. That I think as we continue to work also with the health centers in communities all across the country, that is an initiative that we're certainly looking to take on, where the health centers in the community can also work with persons in the community and bring awareness to them as it relates to the services. So definitely.
Thank you so much.
You're welcome.
So I now have with me Dr. Sarwan, who is the head of the men's health unit. It's a pleasure to have him on our feature. Good morning, sir. How are you today?
Hi, good morning. It's a pleasure to be here on your program.
All right. So could you tell our viewers a little bit about the men's unit that you are head of?
So the men's health unit is actually part of the primary care services unit at the Ministry of Health on the program 3. And what we look at men's health. So when you talk about men's health, it's not just about the penis and prostate alone. It's about the entire man from head to toe. So we look at mental health issues that affects men, emotional issues that affect men, physical issues that affect men, social issues that affect men, because all of it come together creates a general well-being and wellness for men. So we want to ensure that men in our society are actually healthy for tomorrow to come.
So let me see if I get this right. So if a man is depressed, or men are depressed, or they need a complete body check, you guys can do that. Your department can look after that.
So what we do, we tend to be advocate for what men's health is. So we create awareness campaign. We tend to educate people. We tend to let them know where they can reach these services so they don't have to come to us. Yes, we do provide it. The Ministry of Health actually has a holistic approach through its tributaries of regional hospitals and health centers. And you can go to any center, any health facility, and request to be screened as a man from head to toe, whether you have a mental illness, whether you have a health problem, whether you have a sexual problem, whether you have an emotional or social problem that is affecting you. There is someone there to talk to you. There's someone there to give you service to actually make you a better man. And that's what we want. We want better man in society.
Anything else you care to share with our viewers before we go?
Not at this point in time. But what I want to share is that today we want to encourage men between the ages of 40 to 69 to take the mantle and go and get themselves screened for prostate disease. All right? Because prostate disease tends to affect 1 in 4 to 6 men in the Caribbean. And we actually mirror that subset of our Caribbean partners. So presently we want to encourage them to go and get themselves screened. Also, we want them to screen for chronic diseases that they may have. Because some men are sitting with diabetes or hypertension and they're not aware of what is happening. So we want to encourage them to go out there and get themselves screened. So don't be macho. Don't create the macho style and stay home and believe that drink 2 Panadol will solve the issue. Get up. There's help out there, and everyone is willing to help you as long as you present yourself with your problems.